Imagine getting a quick injection to make you look a little younger. Sounds like no big deal, but then something goes wrong. Insider Dr. John Martin says fixing this can take years. Here's why. How treatable is it when a patient comes into you? I mean, I know every case is different.
Right. It's very difficult. It's very, very difficult because what happens when you inject these things is it's not just right underneath the skin. It has sort of penetrated all these different levels. So if you think of it as a sponge, you know, it's all different layers of the sponge. So under your skin, it might be in the fat, it's in the muscle, it's in all the subcutaneous tissue. So even though it feels like a distinct nodule, it's really everywhere. So if you want to take that out, you're going to take out pretty much everything that's underneath it, and then you're going to get a big hole.
And you told me it kind of feels like rocks sometimes.
It is like a rock. It's like concrete in there. So when you're cutting it out, it's very, very difficult to cut it out. And it creates a lot of bleeding, and it creates new scar tissue. So what we've been trying instead is something called a microfocused ultrasound. So it's very high intensity ultrasound. And what the ultrasound does is it delivers a deep heat in there to sort of break up some of the tissue so that hopefully your body can take care of it. In lips, it works actually pretty well. In some of the nodules, as long as they're not too big, it'll work fairly well there. We also do injections of anti-inflammatories to break up the inflammatory component. So in some patients, we can shrink this down, and at least they'll look better. But what can happen is they'll do great, let's say, for a year, and then all of a sudden it can get inflamed again and come back. Then they have to come in for another treatment. So it's just a series of treatments. It never really goes away.
I was going to ask you that, because do they come in hopeful that you're just going to bring them back to what they were?
Yes.
Or is that just not a realistic goal?
It's not a realistic goal, but that's what
the damage is done.
Damage is done, but they all think, oh, just cut it out.
Just take it out.
Take it out, no big deal. I'm like, it doesn't work that way. You know, especially let's say you have a big nodule here and I take it out. Well, now you have a big depression. Eventually, maybe we can put a little fat in there or something else, but it's also hard to get out all the product. So sometimes you think, okay, they're doing well, and it's all gone. And then a year later, all of a sudden it becomes inflamed again because it's very hard because it's everywhere. And they may have that nodule, but they may have little pieces of silicone in other places that you just didn't see or didn't feel.
So this is not like one and done. This takes time.
No. Oh, this is years and years of treatment.
So that injection that you put in, which was quick, now results into years and years of trying to repair it.
Yes. Absolutely.
Ave Maria. Oh my gosh. Okay, so does insurance cover something like this?
No.
So you paid for the job, which was cheap anyway.
Which was cheap, and now
you're going to pay big bucks for the mistake, which is not cheap at all.
And is not going to make you look great.
Oh my gosh.
It's going to make you look better, hopefully, but it's not necessarily going to make you look really good. Sometimes we're pretty lucky and people can get back towards where they were, but it's almost impossible to get people really looking good.
Are you left with scarring of some sorts?
Yeah. If you, like on one patient that we'll show, we did an incision over here to do sort of a facelift flap, lift it up, try to get out some of the stuff. We got out some of it, but it was like big concrete boulders in there. So we were able to kind of chip away at it, get some of it out, looked better, but didn't look great. And
when you see it, doctor, I mean, does it, oh my gosh, what does it look like in there?
Well, it looks sort of like coral rock, but it has all sorts of blood vessels in it. So as you're cutting it out, you get a lot of bleeding. So it's not an easy procedure. And if you come, you know, let's say you do it through the skin, well, every time you take out something through the skin, you're going to get a scar. Now, this is an interesting case of someone who did it. And in the top left, what you see are these nodules that she had, and they're everywhere. This is the one that we went in and tried to take some of it out, and you can see it's better in the bottom. Then she went on to Botched, and that's the top right. And you can see that it's a lot better, but that's, I will say that.
Look at, I mean, I'm looking at the one in the left. Look at that huge.
It's like a mountain in her face, you know?
Oh my gosh, but that's, doctor, I mean, with all due respect, that is so much better, what you did for her.
Well, on the top is when she had a facelift, but it's also very soon afterwards. So she's a little swollen and looks pretty good. The bottom right shows a year later, and all of a sudden it's coming back again.
Oh my goodness. So that was a year later and it's coming back.
It's coming back. So you think you have it all out, but you don't. And so now we're going through the injections again and the heat again to try to get rid of whatever's in there. So it doesn't go away.
My goodness. Earlier we showed an image of a patient who went to see the doctor, Dr. Martin, and was really destroyed, emotional. Let's see what you did for her, and let's see the before and after.
This is just
wow.
This is just showing the lips. By taking it out, you get rid of those nodules. The smile is better, and her lips don't fall out anymore when she,
she could put them back in by herself.
She could put them back in by herself.
Oh my gosh.
And even the cheeks are better. They're not perfect, but definitely she's much happier with her smile, because that's what a lot of people are unhappy with, is the big nodules in your lip, and you just can't smile normally.
With all due respect, it is much better, and she must have been so
Yeah, she was very happy that at least now she had a nice smile. Yeah.
Oh my goodness, thank goodness she went to go see you. Just a quick moment to show you our toll-free number in case you have a question for the doctor regarding fillers or plastic surgery for that matter, 855-796-4475. How soon do they see the results from the before and afters?
Well, from let's say excising the lips, they're pretty swollen for about a week or two, and then it looks pretty good. So it's just, that is a pretty quick fix. But that's the only fairly quick fix, is doing the lip excisions. Any of the other excisions, it takes much longer to heal. You get an inflammatory process both from the surgery and from whatever's in there. So that can take a while to heal, weeks at a time. So it's not quick.
No, it's not. Okay, so let's take a look at another patient of yours, before and after, and tell me about this story here.
Okay. This is a woman who actually went to a real doctor, and she had won a prize to get these injections into her face. So she had multiple injections.
Oh my gosh, poor thing.
Ended up getting all these different nodules on her face. And what we've done is gone in and tried to fix, because her lids were pulled down. She had all these different nodules in there. And what we've done is gone in, sort of tightened the lid, put some fat in, tried to take out the substance that's there. But we've done multiple surgeries to get to a point where she actually looks pretty good now.
So this is a real doctor that just really didn't know what he was doing, with all due respect, again?
Exactly. He was putting in a filler that was, I think it was FDA approved, but definitely not for under the eyelids. For under the eyelids, there's really nothing approved to put under the eyelids. But if we do put some of the hyaluronic acids in there in what we call off-label, but you can only even then put 1 or 2 of them in, because otherwise they get too swollen. So putting these other fillers in, really off-label and really not a good idea, because you get this chronic inflammatory response with nodules and scarring.
Can you imagine that? You win a prize, and for what? That patient, by the way, ended up needing multiple surgeries to undo just a cheap filler. So please, be careful whatever you do.